I'm hoping to talk to you a little bit about the Affordable Care Act and its effects on rural Missourians. And this, as we know, is the battle's raging in DC right now. It's a very hot issue, and I think a lot of people actually aren't completely clear on exactly what this is. So we start out by explaining a little bit about what the Affordable Care Act does for especially locals.
Sure. First of all, I think a good thing to mention is that this is simply another way for people to purchase affordable health insurance. You can go through a broker, you can go through a certified application counselor through HCC and our affiliated network members, or you can go online and purchase insurance on your own, pricing it out apples to apples based on certain criteria that each insurance carrier is required to provide based on their participation in the marketplace. I was also going to mention that if you are a Medicare member, you do not need any other additional health insurance. You just need to continue to work with your Medicare provider. If you're currently on Medicaid or your children are on Medicaid, you will not want to drop that service. And if you have employer-sponsored health insurance, you also do not need to drop those services.
All right, so the only people affected are those who are currently uninsured, pretty much.
Right. So what we are encouraging people to do is if you do not have health insurance, to log on to our website, hccnetwork.org/marketplace, to get to the Affordable Care Act link to register to determine your eligible prices for health insurance beginning October 1st. If you fall between 100 and 400% of federal poverty level, you are able to get either a tax credit or a subsidy based on your adjusted gross household income. And there is also other information that is on there relative to purchasing and the process, and it will walk you through step by step. Currently, if your employer sponsors health insurance for you and your cost on that health insurance is more than 9.5% of your income, then you are also eligible to purchase on the marketplace. If it is not 9.5%, you are encouraged to keep your employer-sponsored health insurance and look at options for a waiver if that is the case, that you feel like that is a financial hardship.
These markets open up on Tuesday. That's the point when people can start enrolling, right?
Right. People can start purchasing insurance as early as Tuesday at midnight. I think it's really important to mention that we are anticipating high volumes of web traffic on that day and encouraging people to give it a few days, let it work out some kinks, make sure that connectivity is not going to be an issue. Regardless of when you purchase your health insurance, as long as it is between October 1st and December 15th, your benefits will start on January 1st of 2014, no sooner. So the prices will not change in that time frame. There is a 6-month open enrollment period from October 1st until March 30th, March 31st. So there's no need to rush on October 1 because no matter when you sign up, as long as it's before December 15th, your benefits will begin on January 1st of 2014.
Besides the marketplace exchanges, can we talk a little bit about some of the other things that Affordable Care Act has done?
Yeah.
Let's start out by touching a little more on some changes to Medicare and Medicaid that have happened.
Well, as you know, I'm sure that you know, the state of Missouri chose to not expand Medicaid benefits up to 138% of federal poverty level. What that means for Missourians is that there will still be a number of people that cannot afford health insurance. Our organization, HCC, we're extremely concerned about that population. We want to ensure that regardless of your health insurance status, you have an option to access services. To that end, we work with safety net providers to connect people that are uninsured or underinsured or on Medicaid or on Medicare to safety net services that have slide fee scales, those types of solutions. The other thing with the Affordable Care Act that implements on January 1st is that women and men, based on their insurability status, will not be seen as different. Right now, a woman pays more for health insurance, particularly if she's of childbearing age, as opposed to the same age male in that same category. So it will now become a level playing field. There will be some people that will pay more. There will be some people that will pay less. We've seen some pretty outrageous rates with regard to what people are anticipating those marketplaces to be in terms of cost. We saw a map for the state of Missouri that showed a 51% increase in health care benefit costs. Of course, I don't know those rates. I can't tell you what those rates will be, but we have been told by our affiliated network members that those rates are extremely inflated and that we do believe they will be affordable come October 1. So you will find that if you're on Medicare, your benefits will not change. You continue to utilize your Medicare as you have all along. In terms of Medicaid, if you're currently on Medicaid, your benefits will remain the same. The state of Missouri chose not to expand Medicaid. So no additional adults will be served through Medicaid. The Marketplace portal that is once again on our website that connects you to the federal website does determine if your children are eligible for Medicaid. So we are encouraging people that even if they think they can't afford health insurance, they think that they're going to fall in that gap, we still want you to go to the Marketplace website. We want you to call our office, have us help you walk through things, just to be sure that there's not any benefits out there that you may be eligible for.
I don't think we've touched on something that's already been implemented. I just remembered it because it affected me personally. Children were allowed to stay under their parents' insurance longer. Do you want to talk about that?
Right, so that stays the same. Children can still stay on their parents' health insurance until the eligible age. However, if they decide not to continue covering their children and they want their children to go on the Marketplace, that is an eligible solution for them. One nice thing about that is that if they have children in college or their children are recently newly employed, their eligible subsidies will be greater than what they're currently paying to be on their parents' insurance right now. So it could become a more affordable solution for mom and dad.
Toniann, I don't have anything else off the top of my head. Is there anything you think we should touch on?
I just want to mention a few things that we are holding outreach and enrollment activities in the 7-county area, which includes Lafayette, Saline, Carroll, Ray, Pettis, Sheraton, and Johnson counties. Those outreach and enrollment activities begin October 10th. They can be found on our website as well, and we will have certified application counselors available with internet access to help people enroll in the Marketplace, or at the very least check their prices at that time. So we encourage people to attend those events. They're free. Again, they need to go to our website or call us to register for those events so we know how many staff to bring that day. But we do want to make sure that we are there to help support people trying to enroll.
Will there be information there so if people want to educate themselves a little more too?
Right, absolutely. If you just want to come and get more information, you're not required to enroll. We can actually sit down and visit with you about what your options are, and you can decide it's not for you, and we can discuss the penalties that could be assessed based on that decision, and it's up to the individual.
All right. Well, Toniann, do you have anything you'd like to add?
I don't think so. Just if people have questions, please call us, and I will get you that 1-800 number in the next 30 to 45 minutes, so you have that that you can announce if it works for you.